welcome to On the Beat, everyone. I'm over here with Dr. Steve Porter from Porter, Singley and Crane Family Dentistry. We're here to talk about the latest 3D scanning in dentistry, and I am telling you, you need to go and see Dr. Steve Porter because this is going to change your life, especially when it comes to reflex in the mouth. If you have a problem with them working within your mouth and you need fillings and crowns, this is the latest and greatest when it comes to the machinery, right?
Absolutely.
All right, let's talk a little bit about what is 3D scanning for dentistry.
Okay, 3D scanning, there comes in two forms. One is to do an optical scan of the mouth, all the structures inside the mouth. The other is to do a radiographic X-ray of the internal structures of the. You can do the whole skull actually.
Oh, really?
Yeah, with that. And so today we're going to talk about what I do, which would be the digital scanning of the mouth. And we use that to treatment plan for restorations, for orthodontics, for all kinds of things. You can even look at gum disease changes in your mouth with that.
Really?
Yeah, you can do that.
All right, well, let's give everyone the visual of what's going on. It's like a pen.
It's like a pen, and you align it over the tooth, hit a little button, and it begins to take a picture. And you just roll it over across the mouth. You don't get back on the back of the throat. You don't get near the tongue where you talked about the gag reflex.
Yeah.
So it takes a picture very quickly. The normal impression that you're used to takes about 3 or 4 minutes to set in the mouth. This can be done in less than a minute.
Well, let's explain what that impression what you used to do.
Right.
And what was it called? It was like
alginate,
like gum or something.
It's like gum or a gooey, runny. Polyvinyl siloxane is what we use a lot. That's the technical name for it. But it can trigger a gag reflex. Doesn't taste too well.
Yeah.
And cost is a little more than probably doing it the other way.
This is really interesting. Just because it's the latest and greatest doesn't mean your dentist bill is going to go up through the roof.
It does not.
Agree?
It does not.
All right, so when we are having our crowns and implants done, what's the process when it comes to using this scanner?
Okay, first the crown is prepared.
Yes.
All the decay or whatever is causing the problem, the broken cusp is removed. Then, very simply, an image is taken of if the crown is on the bottom, you take an image of the lower arch. Then you take an image of the upper arch. Then you take an image of the bite together. That lets the technician that's making the crown know how high, how wide to make the crown.
Yeah.
Then push a little button, send it to a lab to fabricate the crown. And we don't have to box and mail up the impressions that we normally take. So.
One thing I do want to touch on, everyone, it's quite interesting when it comes to simulations of the smile. And that's where this is a killer. It's the best machine.
So we can take an image of the smile, the way the teeth are, and then on the computer actually manipulate teeth around. We can lighten them, we can move them into different positions. This is good for planning orthodontic cases or for planning anterior front teeth restorations, just to see what it would look like before we do the work. And it's so nice for a patient to know what's going to happen before it's done.
Yeah. Now, scanning in relations to orthodontics, is that how's it working for that?
Okay, really, really good. It works really well for the clear aligners, which like Invisalign, if you've heard of that. What it does, it makes up pre-treatment model, and then you can simulate all the different changes that each of those clear aligners will make as you go. So you can do all that on a computer without printing out anything. And then make the actual aligners to wear over a sequence of time, and which actually move the teeth over a sequence of time.
We appreciate everything you do. If you want to find out more information about Dr. Steve Porter, there it all is up on the screen for you. Porter, Singley and Crane Family Dentistry. Back after this short break.